Dr. Richard, what are the potential side effects or complications of CAR T cell therapy?
So there are several possible side effects with CAR T therapy. It's a little different from autologous transplants. And I bring that up just to say because they're both cellular therapies, so are frequently compared and contrasted with autologous transplants, which we have had for about 3 decades now. So the main side effect that for after CAR T therapy is something called CRS, or cytokine release syndrome. So that happens when CAR T cells recognize the myeloma cells and kill them. A host of chemicals called cytokines are released in the body, and this can make a person feel like they have a bad case of the flu. So
Well,
it
who
may be
might
things
this
like
approach be right
fevers,
for?
chills,
What
body
determines
pains,
eligibility?
headaches, loss of appetite, nausea, fatigue. So these are some common, symptoms of cytokine release syndrome. But these are the milder forms. So in more severe cases of cytokine release syndrome, you can have things like drop in blood pressure, drop in oxygen levels, needing supplementation with oxygen, or in terms of drop in pressure, they may need fluid resuscitation, or sometimes even pressors, blood pressure medications that help to boost the blood pressure. So that's one major side effect. Another is something called neurotoxicity. So you can have neurological side effects from CAR T therapy, which when it occurs in the setting of CRS, that's called ICANS, or immune effector cell associated neurotoxicity syndrome. That's what that acronym stands for. And it can be, has a constellation of symptoms such as confusion, disorientation, difficulty with some common everyday tasks. The handwriting may go off, attention deficit, things like that. But then there are, in more severe forms of ICANS, you can actually have lethargy, coma, seizures, brain edema, so much more scary things. Then there's another form of toxicity called delayed neurotoxicity, which looks completely different. Now you have things like Parkinson's disease or neuropathies, either cranial nerve neuropathies or peripheral neuropathies, Guillain-Barré, which is a kind of ascending paralysis. So all of these are also possible as neurotoxic side effects from CAR T therapy. Aside from these, there is another which is called HLH, or macrophage activation syndrome, or hemophagocytic lymphohistiocytosis syndrome, wherein patients can have organ toxicity, spiking ferritin levels, new fevers, new neurotoxic symptoms, additional lab abnormalities, such as liver function test abnormalities. So these are other forms of neurotoxicity, of just general CAR T cell toxicity. Then in addition to these, you can have infections, prolonged blood count abnormalities, cytopenias as we call it, which can affect, the white cells or the platelets or anemia and things like that. So these are also possible. And then finally, things like second primary malignancies, which can happen, other malignancies that can happen that may be related to CAR T therapy. A lot of these are still being studied. We don't have a good understanding of how frequently this happens, but these are all possible side effects of CAR T therapy.
Do any of the complications have to result in hospitalization, or can patients be treated outside the hospital?
So the way things stand now, and this may be slightly different depending on the specific CAR T product, but we generally keep patients hospitalized for the first 2 weeks after their cell infusion. Most of the side effects, such as the CRS and the ICANS, tends to occur during this hospitalization phase. HLH and delayed neurotoxicities can occur while they're still in the later phases of their hospitalization, or it can occur later after they get discharged from the hospital. Infections and cytopenias, of course, can happen for a while following CAR T therapy. Once they're discharged from the hospital, we ask that they stay close to us, usually within an hour or two of the hospital, so that they can quickly come back in if there's any issues. We see them quite frequently. Once they get discharged from the hospital, I see them at a minimum of once a week, more frequently, at least a couple times a week, or even 3 times a week, depending on what their blood count needs and monitoring needs are. So we have them stay close to the hospital if they are far away. And, the sponsor and our social work and the insurance can work together to figure out, how to help them with the hotel costs if they have to stay close to us. And that's for an additional 2 weeks after they discharge from the hospital. Following that, patients go back to their homes. But we still follow them quite frequently, depending on what their needs are in terms of possible side effects.